Go.
Hi, my name is Jonah. I'm a student physical therapist, and today I'm going to make a video going through a lumbar examination and just all the parts that are included in that. And to start off, I like to get a baseline assessment of the patient's pain. So today I'll be working with Mitchell as my patient. Nice to meet you, Mitchell. I'm Jonah. So to start, I like to get an initial baseline of his pain. I'll just ask him a couple questions about his pain, and then from there, I'm going to make sure to have him let me know whenever he feels the pain that's brought him in today throughout the whole assessment. So, Mitchell, why don't you tell me what kind of pain you've been feeling that's been bringing you in today?
Mostly feeling pain right around here in my back whenever I can kind of either lean back like this or when I'm sleeping or stuff like that.
So, in your right lower back, you'd say?
Yeah, probably like right there.
Okay, and could you describe the pain for me? Is it sharp, tingling, burning?
Yeah, it's a sharp pain. It can tingle a little bit down into my legs, but.
Okay. So, and you feel those symptoms you said when you extend back usually?
Yep.
Okay. And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt, what would you say is your current level of pain right now?
Probably like a 3 right now.
3 out of 10, all right. And when you extend back, is that when it gets the worst?
Gets pretty bad, probably up to an 8.
8 out of 10, okay. Alrighty, so I'm gonna take you through the lumbar examination, look at a bunch of different things, but throughout the whole process, whenever you feel the symptoms that you've been feeling to bring you in here, just let me know, okay?
Okay.
Alright, so next part of the lumbar exam is I like to do a functional assessment. And for this, I'm going to have Mitchell do a couple squats. I'll look at him from different directions, straight on, from the side, from the back. So if you could go ahead and stand up for me, Mitchell. And I'll have you go ahead and do a squat just as you usually do. Okay, one more time. All right, and what I'm looking for here is I'm looking to see if he keeps a straight spine or a neutral spine in line with the tibias. I'm going to look to see if he has anterior pelvic tilt. So I'll look from the side also. Could you do a couple more squats for me? Okay, good. One more time. Okay, and it looks like his pelvis is pretty neutral. I don't see any anterior pelvic tilt. His spine also looks neutral. I don't see any excessive lordosis or kyphosis going on. So that'll be it for the functional assessment. And after the functional assessment, I like to go into observation. So first, I'll have you go ahead and sit down for me. And you can just go ahead and sit however is comfortable for you, however you usually sit. And do you have any symptoms right now? No, okay. I'll have you go ahead and bend forward for me as far as you can. Any symptoms there? Okay, back up to neutral. Now, arch your back as far as you can. You got some pain there? Okay, is that the same pain that brought you in?
Yeah.
Same symptoms?
Same kind of thing.
Okay. All right, and now I'll look from the side and from the back. So from the side, I'm looking to see if he has any excessive lordosis of his lumbar spine. I'll see if he has excessive kyphosis of his thoracic spine. And I'll also look to see if he has an anterior or posterior pelvic tilt just from sitting. But everything looks normal. I don't see anything sticking out to me here. Looks neutral. And from the back, I'll also be looking at his alignment. So what that includes is, with your permission, Mitchell, I'll just feel down his back and spine to see if he has any scoliosis. Feels good to me. I'm also looking to see if he has a lateral shift to one side. It looks pretty even. I don't see him shifting to the right or to the left. And I'll also look at his shoulder height to see if they're even or if he has one scapula higher than the other. But I don't see anything there. So now I'll have you go ahead and stand up, Mitchell. And if you could face me. So now I want to see his posture standing also to see if any changes indicate that he has a fixed or a static posture. So I'll be looking for the same things: excessive kyphosis, excessive lordosis, anterior or posterior pelvic tilt, it looks the same as from when he was sitting. So I wouldn't say he has a fixed or a chosen posture. And now I'll go ahead and move into the range of motion part of the lumbar examination. So first I'll have him just start off with active range of motion, so he can stay standing for me. And during his active range of motion, I'm going to be looking for any aberrant movements. So this will include things like a deviation, painful arc, a hinge spot as he's going down. I'll just look at his lumbopelvic motion, reverse lumbopelvic motion. So to start off, Mitch, I'll have you go ahead and lean forward, try and touch your toes for me. Okay, and back up. Any pain with that? Okay. Go ahead and arch your back and lean back as far as you can.
That's about all I got.
That's painful?
Yeah.
Okay. If you can, I'll have you go ahead and try and do that 2 or 3 more times. Let me know if it gets too painful.
That actually feels better.
This is feeling better?
Mm-hmm.
Okay, so I have him do the repeated motions with the pain because that will help me, it'll indicate if possibly it's a joint issue. In his case, his pain actually decreased, so it leads me to believe it may be a joint issue because it got better with pain. Whereas if it was a muscle issue, it would get worse with repeated motions. So I'm also going to go ahead and add some stability now and go ahead and lean back just like before and back to neutral. Any pain with that?
Mm-hmm.
Okay, so he also benefited from stabilization. It decreases pain. So that lets me know that stability may be a problem. So now I'll have you go ahead and run your right hand down your leg as far as you can. And come back to neutral. Any pain there? Okay, now same thing on your left side. Left hand down your leg as far as you can. Back to neutral. Any pain with that?
Nope.
Give yourself a hug. And look over your right shoulder as far as you can. Back to neutral. Any pain? Over to your left shoulder as far as you can. Back to neutral. Any pain with that?
Nope.
Okay. So when I was assessing his active range of motion, I didn't see any capsular or non-capsular patterns. And a capsular pattern would mean he has pain on both sides. So for example, if he's extending, he has pain. And I did see a directional preference because when he extended, he had pain, but when he flexed, he didn't. So I would say he has a directional preference of flexion. And I didn't see any deviation, so when he was bending down to touch his toes, I didn't see him go off to one side. He was nice and straight. And so now I'll go ahead and move on to passive range of motion. So the first part of passive range of motion I like to do what's called a quadrant test. So Mitchell, for this, before you go ahead and do it, I'm gonna show you how it works, give you a demonstration. So for the quadrant test, it's just maximum closing. So I'm gonna have you lean back, first side bend to the right, and then you'll look over to the left, all at the same time, okay?
Sure.
You can come back. So whenever you're ready, extend back, over to the side, and then look over to your left.
Kind of hurts.
You got pain with that? Okay. So that would tell me he's having pain with closing on the right side. Now I'll also do the same thing on his left side. So go ahead and bend back, over to the left, and turn and look over.
It hurts, dude.
You got pain there too? Okay, so he actually had pain bilaterally. So now I would actually say he does have a capsular pattern since he's having bilateral symptoms. And so for continuing on with the passive range of motion, I'll have you go ahead and lie down on the table on your side. You can take your shoes off too. And to start, I have you scooch over as close as you can towards me. And I'm gonna passively pick his legs up and take him into flexion and extension. So for this, you can just go ahead and relax. And I'm just gonna take him into extension, flexion. I'll just do this a couple times. Any pain with that?
Low pain with that.
Okay. Is there pain when I bring your legs this way or back?
When you bring them back.
Bring him back? Okay. So he's having a little bit of pain with passive extension. And now I'm gonna look at his passive side bending. So again, you can relax, Mitchell. And I'm just gonna passively side bend him here. And I'll just do this a couple times. Any pain with that?
A little bit of pain.
A little bit of pain. Is it bearable?
Yeah.
Okay, I'm just gonna do a couple more. Did it get better towards the end or the same?
It was about the same.
About the same, okay. So he's also having some pain with side bending on the left, so I'll have you go ahead and flip over too. And I'll assess his side bending on the right side also. So again, you can relax. Any pain with that?
A little bit, yeah.
Okay. So he's also having pain on his right for side bending passively. So that wraps up the passive range of motion part of the lumbar exam. So now I'm going to move on to mobility. So first I'll be doing some central PAs to test the mobility of his lumbar spine. And then I'll do some unilateral PAs for the facet joints as well as bilateral PAs for the facet joints. So if you could go ahead and roll over to your stomach, please. Okay, and with your permission, I'm gonna lift up your shirt. And to find L5, I'll find his PSIS's, move over straight from there, and this is L5 right here. And to find L1, I'll find his bottom of his 12th rib, move directly over, and this is L1 right here. So I'm gonna start at L5, and I'll just do a central PA with the outside of my hand. And when I'm doing these, just let me know if you feel any pain, okay?
Yeah.
So that's L5, L4. Any pain?
No.
L4, L3.
No.
Any pain? L3, L2. Any pain?
Mm-mm.
L2, L1. Any pain?
No.
Okay, no pain with those. So now I'll find L5 again. This time I'll go off to one side and do a unilateral facet joint PA. So that's L5. Any symptoms?
No.
L4, any symptoms?
No.
L3, any symptoms? L2, any symptoms?
Mm-mm.
And L1, any symptoms?
No.
Okay, now I'll go ahead and do the other side. Find L5. L5, any symptoms?
No.
L4, any symptoms? L3, any symptoms? L2, any symptoms? L1, any symptoms? Now I'll go ahead and do the bilateral PAs. Starting with L5 again. L5, any symptoms? L4, any symptoms? L3, any symptoms? L2, any symptoms? And L1, any symptoms? Okay, so he didn't have any symptoms with any of the PAs, so that tells me he has good mobility. Everything, all his end feels felt normal for the lumbar spine. So next I'm gonna move on to some muscle length testing. And the two muscles I'm gonna look at here are his lats and his QL. So I'm gonna go ahead and start with the lats. So you can go up on your hands and knees for me. And to test the muscle length of the lats, I'll start by having you grab onto the table here. And now try and bring your butt to your heels. Okay, and it looks like he's able to bring his butt almost to his heels while his shoulders are up. So that tells me his lats don't look abnormally tight. They have pretty much normal muscle length. So you can go ahead and relax. So that's it for the lats. And now to assess the muscle length of the QL, I'll have you go over to your right side. And I want you to go ahead and hold on to this part of the table right here. And now I'll be bringing his legs off of this side of the table. And that's to just put his QL on stretch so I can see the muscle length. So I'm gonna bring his legs off the side of the table here. Okay, go ahead and relax. All right. And here, as you can see, his feet are able to come below the table. So that tells me his QL isn't tight on the left side. You up. And if you could go ahead and flip over to the other side for me. Now I'll just test the QL on his right side. So again, you can just hold on to that side for support. Try and relax. And I'll just let his feet fall again. As you can see, it's pretty much the same as the other side. His feet are dropping below the table, so it tells me his QL is not tight on the right side either. Okay, so that wraps up the mobility portion. So next part I like to do is the muscle performance part. So for this, I'm going to be assessing his transverse abdominals and the multifidus. So I'll go ahead and start with the transverse abdominals. So I'll have you lay on your back for me. And here, for both muscles I mentioned, I'm assessing activation as well as control. So I'll go ahead and start with activation, and for this, I'm going to be feeling just in this region right here, in your lower abdominal region. I'll be seeing if I can feel your muscles activate. Is that okay? Yep. Okay, so I'm going to lift up your shirt with your permission. Be feeling right here. And a good way to see if they're activating is I'll just have Mitchell cough a couple times. Go ahead. Okay, I'm feeling activate there. And now can you try and brace yourself, kind of squeeze your stomach? I'm feeling good activation there too. So I'd say his transverse abdominals are normal. They're activating like normal as they should. And so now I'll go into the control part of the test. And for this, I like to do a double leg lowering. So I'll have him start with both legs straight up. Yep, so you can hold them there. And now I want you to brace as I had you before, brace your lower abdomen, and try and push your lower back down into the table. And try and keep that all controlled and pushing your back into the table as you're lowering your legs down the whole time. And I'll be feeling under here to feel when it. Okay. So I felt his lower back come up off the table, but his heels were just above the table, maybe 0 to 10 degrees away. So I'd say that's normal, so he has good control of his transverse abdominals. So the next muscle I'll be looking at is the multifidi. So for this, I'll have you go ahead and stand up for me, Mitchell. And you can face the window there. So for this, testing the activation of the multifidi, I'll have Mitchell in a sec here. I'll have him step forward with his right leg and lift his left arm up. And that will let me feel if his left multifidus is activating. And I'll do the same thing for the other side. So for this, I'll have to palpate your back. Is that all right, Mitchell? Yep. Okay, so I'm going to start with the left multifidi. And it's pretty deep, so I'll be feeling in here. And so now, whenever you're ready, go ahead and take a step with your right leg and lift your left arm up at the same time. Okay, good. Now, actually this time, can you step with your right leg and lift your left arm up? Yep. Okay, so that time I felt it activate on his left side. So now I'll go ahead and do the same thing for the right multifidus. So now, go ahead and take a step with your left leg and bring your right arm up. Okay, good, and come back. I felt the right side activate that time too. So he has good activation on both sides for his multifidi. So now I'll go ahead and test the control. And to do this, I like to do an activity called the dead bug. So for this, go ahead and go on your hands and knees on the table for me, please. And so whenever you're ready, I have you go ahead and kick your left leg back and bring your right arm up at the same time. Okay, good, and back to neutral. So here I'm looking at his pelvis to see if it remains in a neutral position. So for his left multifidus, it looked like he had good control because his pelvis remained neutral, it didn't start to tilt. So now I'll have you do the same thing, kick back your right leg this time, left arm. Good, and back to neutral. So same thing for his for the multifidus on the other side. Also saw good control, no tilting of the pelvis. So that'll wrap it up for the muscle performance part of the lumbar examination. And next, I move on to special tests. So first special test is called the Hoover test, and you'll be on your back right here on the table. And for the Hoover test, I'll be supporting below his both ankles right here. And Mitchell, whenever you're ready, go ahead and lift your right leg up, back down, left leg up, back down. Any pain with that? Okay. So he was able to do that. And the Hoover test, the purpose of this is if he was unable to lift the leg I wanted him to, and I didn't feel him pressing down with the other leg into my hand, it would tell me that perhaps there's some malingering going on, but Mitchell did a good job there. So next special test I'll move on to is prone instability. So for this you can go ahead and stand up. And I'll just give you a demonstration first of how to do it. So for this one, you'll be, I'm gonna move this up a little bit. So for this one, you'll be laying on your stomach on the table, and you can grab onto the sides for support, and keep your legs on the ground for now. And I'll apply a central pressure to your lower back, ask you if you have any pain, and then I'll have you lift your feet up just slightly off the ground. I'll apply the same pressure to your central lower back, and see if you have pain again. So whenever you're ready, go ahead and lay on your stomach. Okay. And so now I'm going to apply central pressure to his lower back. Any pain with that?
A little bit.
Got some pain there? Okay. Now I'll have you bring your feet up off the ground slightly. I'm going to apply the same pressure. Any pain? Okay, so his pain actually went away while his legs were raised, so that'll tell me this is a positive test for prone instability. And it tells me he may benefit from a stabilization program. Okay, so next special test I'll move on to is also for segmental instability. It's called the active straight leg raise, so I'll have you laying your back for me. And for this, I'm just simply letting Mitchell lift each leg up one at a time by himself. And I'll be looking at his range of motion and seeing if he has pain on either side. So whenever you're ready, go ahead and lift that right leg up.
Kind of hurts.
Got some pain there? Okay, so I'm seeing some limited range of motion on the right side, some pain too. Same thing on the left. Pain also? Okay, so he had about even range of motion for his right and left and had pain. So now I'm going to go ahead and add some stability. I'll be adding stability to the lumbar spine, the pelvis, and by the greater trocaners. Okay, and now I'll have him do the same thing. So when you're ready, lift your right leg, back down. Any pain? Okay, left leg, up, back down. Any pain? Okay, so with the stability, it looks like his pain decreased. He even got a little bit more range of motion, so he could benefit from stability. So next special test I'll move on to is called the straight leg raise test, and this is testing for neural tension. So with this time I'll be passively bringing each leg up, and if need be, I'll add some sensitizers to see if he's feeling any neural tension down the back of his thighs. So just relax for me. I'm going to bring your right leg up. And let me know if you start to feel any tension in the back of your thigh.
A little bit, yeah.
Right there? Okay. So now I'm going to back off a little bit. I'll add a sensitizer by dorsiflexing. And let me know again if you feeling tension. Okay. So for that, he was feeling some tension even without the dorsiflexion. So another sensitizer you can add if they're not feeling tension by that point is for them to flex their neck, and that will put the nerve on even more tension. But now we'll go into his left leg. Same thing, you can go ahead and relax. I'm going to bring his leg up. Let me know when you feel tension. Nothing there? Okay, now I'm going to put him into some dorsiflexion. Let me know if that changes. No tension? So now, could you go ahead and lift your neck up for me?
That hurts a little
Feeling some tension there? Okay. So it looks like his right leg actually has a bit more neural tension than the left. He displayed some symptoms sooner. So next special test I'll move on to is called the slump test. So if you could sit up for me and move to the edge of the table. And the slump test here, it's similar to the straight leg raise, except now he's seated. And the reason for this is so I can bring some thoracic kyphosis into play to put the nerve on even more, to stretch the nerve even more. So first I'll test his right side, and I'll bring his leg up. Any tension there? Okay, I'm gonna dorsiflex him. Any tension there? And now can you slouch forward for me?
Yeah.
Feeling tension there? Okay. So now go ahead and do the same thing on the left. Bring your leg up. Any tension? Move to dorsiflexion. Any tension there? Now same thing. Slouch forward. No tension there? Okay, so he had a bit more neural tension on the right side for that one. And that wraps up the special test. That was the last one for that. And to finish off the lumbar examination, I end with palpation. And I'll be palpating the spinous process of each lumbar vertebrae, L5 to L1. I'll be palpating all of the erector spinae, and then finally the QL. And I'll just be seeing if he has any tenderness with any of these, or if I notice any muscle atrophy or anything, or any abnormalities. So I'll have you go ahead and lay on your stomach first. And with your permission, I'm going to lift up your shirt. Okay, so I'm going to start, find the PSISs, go right over, here's L5. I'll get right over the spinous process. And Mitchell, I'm going to go ahead and apply a little bit of pressure. Let me know if you feel any symptoms. So there's L5, no symptoms. L4, any symptoms? L3, any symptoms? L2, any symptoms? L1, any symptoms? Okay, so he didn't feel any pain with that. I didn't feel any abnormal drop-offs or anything. So next I'll move on to the erector spinae. And I'll be pushing down. Any pain there? So no pain with the medial erector spinae. I don't notice any imbalances in muscle tone or anything. So now I'll move to the next erector spinae. Any pain there? Okay, again, they're symmetrical. The most lateral erector spinae. Any pain? Okay, and again, they feel symmetrical. So next I'll palpate the QL. So this will involve finding the most lateral erector spinae, dropping off, and then kind of going under. Any pain with that? Okay, he has no pain on his right QL, so I'll test the left one. Same thing, I'll go to the most lateral erector spinae, curve under. Any pain there? Okay, and I didn't notice any differences in muscle tones either. So after palpation, that will wrap up the lumbar exam. But I did forget one thing with the observation, it's soft tissue. So Mitchell, if you could go ahead and sit up for me. And could you take your shirt off too, if you don't mind? So yeah, going back to the observation part of the exam, I did look at his posture, alignment, but another important factor is his soft tissue. So for this, I'll just be looking at his muscle tone to see if there's any imbalances there. I'll be looking for any abnormal contours, rashes, bruising, surgical scars, things like that. So for this, I'll look from the back. And I don't see anything abnormal, nothing sticking out to me. And while I was palpating just earlier for the palpation at the end, I didn't notice any muscle tone imbalances, and I don't see any. So he looks pretty good there. But yeah, that'll wrap up the lumbar exam video. Thanks for watching.